When someone's brain shrinks over trauma, physical trauma, emotional trauma, whatever it might be, when it shrinks, obesity, what happens to the brain inside the skull? Is there more room? Is there more fluid in between the brain and the skull? Like, what is actually, how small could it be? Is it rattling? Like, what is actually happening with the space between the brain and the skull when it shrinks?
So it gets bigger. The space gets bigger.
Space gets bigger.
And so fluid
expands.
will take it up.
Okay.
Because your brain's, has to be contained. But that's not what you want.
You don't want fluid.
You don't want
a lot of fluid.
More fluid. In fact, if you have too much fluid, it's called hydrocephalus, and that can shrink the brain. One of the causes of Alzheimer's disease is called NPH, or normal pressure hydrocephalus. And when we put a shunt in and drain some of that excess fluid, people actually think better.
Put a shunt in the brain, the skull. Open up the skull.
Put a shunt, and then we have it drain into your abdomen.
Really?
Yeah.
How does that
And
work?
that's not uncommon.
You put something in the brain and it goes down?
Think of a tube.
tube
to
goes
just
from the outside of the
drain.
body, or what?
No, inside. Well, they'll tunnel it underneath your skin and
Really?
neck and so on.
It goes all the way down?
Yeah.
That's a crazy...
I actually did a
procedure.
study, it was fascinating, on something called omental transposition surgery, where we took the omentum from the gut, so it's like this fatty apron on top of your abdominal organs, and it's loaded with stem cells. So we actually bunched it up and put it on the brain, but kept it connected to the blood supply in the gut. It was pretty wicked surgery, but we found it really improved cognition. Now, this was before the whole stem cell movement. We've been working with stem cells to improve brain function.
That's crazy.
Pretty interesting.
Crazy. I want to ask you about dopamine. In the last, I believe, 7 years, I feel like with social media, smartphones, kids having smartphones much earlier and earlier, video games, the access to these things, the constant dopamine hits that we're all getting more with our phones. What does an overwhelm of dopamine do to the brain? Does it support brain health? Does it hurt brain health? Should we have only 10% of the dopamine we're getting? What is it doing to our function of our brains?
Dopamine's really important. It's a very important neurotransmitter. Now, there are a bunch of them that are really important. Serotonin and oxytocin and endorphins and cortisol. Dopamine works on the area called the nucleus accumbens, which is the pleasure center in the brain. Push on that and you feel, whoa, I like that. If you push on it too much or too intensely, it wears it out. And which is why my book, Feel Better Fast, there's a whole section on drip dopamine, don't dump it.
Don't dump dopamine on yourself.
Don't dump it. In fact, in Your Brain is Always Listening, I have a brand new 12-step program. The 12-step program for addiction was actually developed 85 years ago and has no neuroscience in any of the 12 steps.
Really?
And one would think the brain should be part of the 12 steps. So I redid the 12 steps. I know some 12-steppers will hate me. But I'm like, well, if a neuroscientist was going to do it, what would I do? And step number 7 is drip dopamine, don't dump it. Because when you dump dopamine, pornography dumps dopamine. Cocaine dumps dopamine. Alcohol dumps it.
Drugs.
Skydiving dumps it.
Yes.
Running with the bulls dumps it, along with a whole bunch of cortisol. You wear out your pleasure centers, which is why in Justin Bieber's docuseries Seasons, he came out, I was his doctor, he talks about dopamine. And I pray that children do not become famous until their brains are developed.
Man,
he was famous really early. And every bad thing happened to him because he felt bad. He had no dopamine left. He'd worn out his pleasure centers.
Getting so much of it all day long, all the attention.
And so part of the therapy was we have to rehabilitate your pleasure centers. And so you want to avoid things that dump dopamine and engage in things that drip dopamine.
What are some of those things?
Like our conversation today. I mean, it's just been so much fun for me. Holding my wife's hand, looking in her eyes, playing with the grandbabies. Oregano drips dopamine. Pumpkin seeds drip dopamine. Magnesium drip dopamine. Rhodiola, ashwagandha. I mean, some cool supplements. So I want to protect my pleasure centers because pleasure in many ways can be the enemy of happiness.
Really?
Because if you have too much, it wears them out and then you begin to feel flat. And that's how addictions start. Something dumps dopamine, you go, oh, that's awesome. Like a young superstar does a concert, and like, that's amazing. But afterwards, they have nothing left.
They're alone in their hotel room or
and they're playing video games, which is dumping dopamine that they don't have. And so then they're like, well, maybe I'll smoke. Maybe I'll vape. Maybe I'll do marijuana or cocaine. And then it's flattening the response. Sugar does this too. It actually flattens the response. It's like, whoa, ew. Whoa, ew. And pretty much you're into whoa, ew.
Your whole life.
That's the addiction.
How, this is going to upset a lot of people. What is the research and the science saying about marijuana in terms of the brain health and marijuana? Because there's a lot of people talking about how it's actually relaxing them. I've never been high on anything in my life. I've never done drugs, never been drunk, never drinking alcohol, except for a couple sips when I was a kid as a taste. But
So your brain is probably going to be better than you think it is.
I hope so.
Right?
So, yeah, never been drunk.
And I'm one of the few people, I've been drunk twice, but I learned quickly. I'm like, no, I don't like to be out of control. It's not for me. All the hater comments come out when I talk about marijuana.
Yeah.
But it was 20 years ago. I was on the radio with Michael Savage in the Bay Area. And he's like, people are just going to hate you when you talk about marijuana.
Yeah.
I said, but everybody who calls in who's been smoking for a while is going to spontaneously complain of memory problems. And everybody who called in complained of memory problems.
I can't remember,
So I knew it was trouble right after I started looking at scans. It makes your brain look older than you are.
How am I? If you're smoking daily or once a week or...
Well, if you smoke once a week...
Is this both?
It's just marijuana.
Wow.
If you smoke once a week, the problem is it's fat soluble, which means it stays in your body for 30 days.
Oh, man.
And so that one decision can actually impact your brain for 30 days. And so if you're smoking a lot, you have a pretty high level in your body. And I published a study with my colleagues from USC on 1,000 pot smokers. We compared them to a group that never smoked.
What happened?
Every area of their brain was lower.
Come on.
Every area of their brain was lower in blood flow. Blood flow is really important.
Now, is it the pot, or maybe they're also eating sugar or drinking, or they're also overweight?
It was the consistent variable that we looked at. And then I did the world's largest imaging study on 62,454 scans, looking just at how the brain ages. What do little kids' brains look like? What old people's brain? What's the trajectory of aging? And it sort of sucks. Really busy brains, kids have really busy brains. It sort of levels out by the time you're 25, 26. And then it stays that way until you're 60, and then it starts to drop off. It's not good. And then we looked at, well, what accelerated aging in our database? And schizophrenia was actually the worst. Their brains were like 10 years older.
Oh, man.
Then the next worst was marijuana. And it shocked us because we looked at alcohol and smoking, depression, ADHD. No, it was marijuana. I'm very concerned. Kids who smoke, teenagers who smoke or use edibles have a higher incidence of anxiety, depression, and suicide.